And then oftentimes when we're talking about a health issue that millions of people face, we love to talk with someone who's actually dealing with it, and a patient, a client, what have you, who is willing and so courageous and wonderful to come and share their story. So Annette Anderson joins us now. I think she's just putting the microphone on, but Annette will talk about her diabetes and what her life has been like and how it's been affected. And I think that always kind of really helps when you're thinking about it or thinking about your own treatment. Of course, we had Rebecca Dennison, too, who has her own story, and I think that must be incredibly helpful when you're talking with your own patients about diabetes. So we're getting Annette all mic'd up, and thanks so much for joining us. Hi, it's nice to meet you.
It's nice to be here. Thank you.
You're very welcome.
Thank you.
I'm kind of thinking you know it all. Did you hear anything new so far today?
It's interesting. I think listening to the last panel talk a little bit about how...
Do you mind if I ask you to come over to this seat? I just want everyone to see your beautiful face.
Oh, I was trying to show them my beautiful boots.
That too. Mine too. We can have a boot comparison later.
Yes.
Awesome.
Oh, yes. I like those.
Yeah,
boots.
right?
Very cute.
Yeah.
Mm-hmm.
So you were listening and kind of taking it all in, and
I was. It's important. I think, people underestimate how diabetes is often connected to so many other life choices. And so I think, hearing about your ears and the possibility that the small vessels have to be also something that a diabetic has to worry about is another thing that I'm like, okay, got to put that on the list. You worry about your eyes, you worry about wounds, you worry about...
Kind of makes sense, right?
It does.
When you think of it as a blood vessel disease.
It does. It just means being uber responsible and taking charge of your life and those decisions. But the good news is you are in control. So you get to make those decisions. It's not a death sentence. It's not a life sentence.
Oh, by any stretch, right?
No, it's an opportunity to retool and to make better choices.
So tell us your story.
Well, like most women, I am super involved in my kids' lives. I'm a good wife, I'm a great mom, and I'm a busy career woman. And so what that meant for me was that I was not really taking care of me well. I was really busy chauffeuring my kids to dance and to sports, and I'd get home and throw dinner together, and then I'd stand in the kitchen and eat whatever leftover they had on their plate, and that was my meal. I wasn't really eating well, and I was using warm beverages. Go through the drive-through and get a caramel macchiato, and that'll help you to get through the day. And over time, that and a very busy career.
Probably no exercise worked in there either, right?
Actually, I was.
Were you going to the gym?
I was. I was, but not consistently.
Okay.
So, I'd realized enough that that I needed to start doing that. I'd lost my grandmother at 96, and so that kind of spurred me into action, right? Because she'd lived this long, very vigorous life, and I decided that I needed to do some things, but had not made the changes to my eating patterns that I needed to. So over time last spring, I just started to feel like tired. I was tired, and there were, my husband had gotten a promotion, and I was busy. I was traveling for work, and just was not feeling like myself. And my boss had actually said one day, he's like, "You sure you're okay?" And I'm like, I'll push through. But that's when he noticed it, then I said, okay, something's up. And then, my husband noticed it. You're just kind of tired. And I didn't want to really...
Like super low energy, kind of?
And I had a sore throat. So I went to the urgent care place because I thought, and we had so much activity going on in the spring. My kids had stuff, I had stuff, everybody had stuff. And I'm the caretaker for my family. So I'm cooking all the time, I'm baking, I'm doing all these things for everybody else. But I wasn't eating and I wasn't taking care of myself. I would, like I said, I didn't eat until I came home at the end of the day. So I might go past a vending machine and see some chips and say, okay, well, that'll tide me over.
That's lunch.
Yeah, that's lunch, right? So I got really tired. So I think what exacerbated
So you went to the urgent
it,
care.
I went to the urgent care and said I have a sore throat, and they were like, "Yeah, we don't see anything." Took a culture. Come back in 3 days if it doesn't get better. Well, by 3 days in, I'm like really lethargic, really low. I'm not eating at all, and I'm drinking all kinds of juices. So Rebecca talked a little bit earlier about, the sugary drinks. Well, I'm like, give me some grape juice, give me some orange juice.
Because you think that's going to give you energy.
Yes,
right.
and vitamins, right? So vitamin C, I need to combat this sore throat. Well, after a few days of that, my husband said, if you're not better tomorrow, we're going to the ER. So we wound up in the ER at GBMC, and I was so exhausted at that point. I said two things to my husband. I said, call my parents, and I said, move over because I want to lay down and go to sleep. And I literally went to sleep in the ER. That's how exhausted I was. I woke up in the back of the ER, and the doctor said to me, do you know that you're diabetic? And I said, no, I don't. And he said, you are diabetic, and your A1C is 17.2. And he said, that's the highest that I have ever seen in my professional career. So they immediately, so this team, shows up, it's like a scene out of ER. And they show up and they whisk me up to the ICU. And I'm like, wait a minute, I can't go here. I have to go to work tomorrow. But I was so tired, and it was almost a relief.
That you gave into it.
Yeah. Mm-hmm. And it was, in a way, it was a relief because now I knew what I needed to retool and do. Because I'm a fixer, I'm a worker.
I get the sense, too, you probably didn't realize how serious it was in the beginning.
No, I did not. I didn't. I thought I had a sore throat, and I thought I was tired.
But I mean, even when they told you had diabetes and what the number, you probably didn't even know what the number meant.
Well, so, it does run in my family.
Okay.
So my grandmother, my grandfather, my father, my mother, and a sibling all have diabetes. But I am not the picture of what diabetes looks like, because in my mind, I'm way too cute to have diabetes. So
they're not here, are they?
Exactly. No, they're not here. But they're cute too. But I just. So but I.
You're just like, it can't happen to me.
It can't happen to me. It can't. But then I learned from Rebecca Dennison that my age, I am at the modal age of people being diagnosed for the first time with diabetes. So, in terms of, the demographic factors, there were so many things that should have made me think, especially because of the family history, that was what was going on, but it never occurred to me. Never. So I'm 4 days in the ICU, and I'm like, oh my goodness, that's
4 days.
4 days. And that's when I realized the fourth morning when I woke up and I'm like, okay, I'm still here. What's going on? And the treatment team came in and they were like, yeah, we think maybe you need to stay. You can step down a little bit, because they had tried all these things. And my blood sugar was coming down, but I was the person everybody was talking about, because no one had seen an A1C of 17.2. And so they were almost afraid to release me. And I had this incredible nurse. I believe her name was Asia. She was just very incredible, very patient. And she just kind of said, listen, you're going to have to take charge with this. You're going to have to get in front of this. And so her gentle way, there's so many gentle, kind people at GBMC, and that made me kind of wake up a little bit, right? Because I was like, I have a conference call. Can I call in to work?
Can someone bring my iPad?
Exactly. And she's like, listen, you gotta take control of this. You gotta see this as, what it is. So I was then kind of that was when the reality hit, and I got a little bit sad, because I'm thinking, okay, so maybe this is really, very serious, and I'm not going to be able to overcome it and go back to my old life. And then Dr. Mina Khan walked in, and she was the endocrinologist who saw me. And so when they were saying that I was going to go to this step-down room and I'd be there for another few days, she turned around and she said 4 things that changed everything for me. She said, you can do this. And she flashed a thumbs up signal. And she said, you can go home. The night before, my husband and my family had brought my 3 children, to the hospital room. And I think when they walked in, that's when I realized, okay, I need to get up off this sick bed and do what I have to do because I have been the caretaker and the organizer, and I am not going to let this lay me out. I'm going to get ahead of this. I'm going to figure out what I can do to be proactive about it, and I'm going to take charge. And when Dr. Khan said that, it was like her spirit agreed with my spirit, and I was like, okay, now we're going to make a plan. And so that's what happened. And so I left. I went home, and my daughter and my son had to go to their middle school dance, and I got to go home. And Dr. Khan said, there's no reason for you to have to stay here one more night when your kids have an important event. You can manage this from home. And she spent an hour or so helping me to figure out what I needed to do. They had the pharmacy right there. The pharmacy team came in and they gave me some supplies. And I think that's when the reality of this hit. I was going to have to take insulin. I was going to have a glucometer. I'm like, whoa, like this isn't just a 4-day vacation. I've got to really make some changes. So I went home grateful and thankful that I was still in my right mind and still in my right body. And I just decided, okay, I'm going to get this together. And it has been a journey.
Oh, I imagine. I mean, the learning curve must have been...
Well, but you know what? You learn how to do things you want to do well, right? So, we got home. My kids went off to that dance. It was wonderful. I got to see them, and that kind of encouraged me, because my kids keep me going. And so that's what, being here for my family, being fully present, being available for them, and, knowing that I wanted to be a good role model for them in their eating, in their habits, in their life habits, that was the motivation that I needed. So that weekend, my husband said, okay, we're gonna go to the store. So we went to the, big box store, I won't say the name, and he said to me, we got 2 carts. He said, everything that you can eat in this store, I want you to put it in this cart. So I did. And we spent 2 hours. And, when we got to the front and it was like $400 something, he was like, that's a lot that you can eat. I said, but that's what you said. So we got home, reorganized the pantry. And from that moment on, everything just changed. There's so many more vegetables in my diet every day. And this is where, Geckel and Rebecca Dennison were like angels for me, because I know a lot. I have a PhD, and like I said, I'm in charge of a lot of things, but I needed to have someone to help me. So the plate diagram that she showed, that was a reminder to me of how unbalanced my eating was. I was eating too much protein here. I was having too many carbs there. So even though today I eat a much more low-carb diet than I have been for a long time, it's helped me to do it in balance. I learned balance through Geckel, and I really appreciated the opportunity to come in with her. So my first time that I went in, when I went back to Dr. Khan after my 17.2 A1C, a month later, it had dropped to 10.1. And everybody was doing a happy dance because they were like, yay, look at you, so improved in a month. And I'm like, no, this has to get better, because, I'm competitive. So now I'm trying to figure
You're shooting
this out.
for 5?
Absolutely. So then another month later, I went back and it was 5.6.
Wow. Yes.
And I went back again at the end of October, and it was again 5.6. So now I am completely off insulin.
Fantastic.
And that was my goal, because I had a cousin out in Denver say, you can do this, but you need to understand that if you decide, you make these choices for yourself. You can decide how healthy you want to be or how dependent on this medication you want to be. And again, like having people in your life and a community to support you. I had people at work who showed me how to meal prep, who sent me to podcasts or Instagram pages about meal prep.
You have a new club, too. I imagine people just came out of the woodwork.
Absolutely,
right?
to support me. So that support system is critical. Having that, my husband, he's just so handsome, and he was, my first champion. And then my kids, when I was saying, I wasn't really eating that bad, and my son said, Mom, you were drinking caramel macchiatos twice a day. Oh, I guess I was.
And also, you must be thinking, too, if this runs in your family,
yes,
they need to learn about it.
Oh, absolutely. So they call me the diabetes police. They hate to see me coming. Yes.
So besides the numbers, which are amazing, how do you feel?
I feel incredible because I feel in charge. I'm optimistic because I'm in charge. This is the message that I have for people who are working through this disease. You have choices. You have choices. They're life choices to live well, and you can heal your body through food. My grandmother used to say that, and now I hear her in the back of my head, because I can still make Brussels sprouts with bacon, but I don't have to put in a cup of maple syrup because that's 53 grams of carbs. Maybe we shouldn't do that. Maybe I'm learning to use things like monk fruit or concentrated apple juice to sweeten things when I want to make desserts, when I want to bake. And the good news is, there's a whole lot of stores that carry, sugar substitutes for when you want to bake for Thanksgiving. So I'm looking into recipes that allow us to have some of those sweet treats, but not too much. But doing things in balance is what's really important. But every time I take out a plate to eat, I'm always putting something green on it. The other thing that was really key for my diet that I had to learn was about items that have low glycemic indexes. So black beans.
I'm glad you brought that up because I don't think we even use that term. I'm
black
shocked this whole
beans
time.
are huge for me. I keep a can of, I'm a huge Aldi shopper, for example, and I put black beans in everything now. Like if I can make a smoothie with black beans, I'm doing that. I love black beans because it's a low glycemic index, but it helps me to really manage the cravings because it has high fiber. So.
Well, I think the world needs more of Annette Anderson, everyone. I think that you should be getting your message out to everyone who is getting a diagnosis of prediabetes or diabetes because really you're inspirational.
And I've lost 30 pounds.
Yeah, all right. Thank you so much for joining us and sharing your story.
Thank you.
And thank you all for being here on Greater Living.